Basically, I am a urologist, a kidney specialist, a professor of urology at a medical college. I am very fortunate to learn most of the traditional systems of medicine like Ayurveda. I am doing PhD in yoga, plus I did my highest education in modern medicine. A urologist is known for his specialized work in stones, kidney stones, a commonest disease which everybody remembers, that once you get a kidney stone, the pain what one gets is similar to labor pains, which even a male has to suffer labor pains because of the kidney stone. The common thing which is been asked or thought by all my patients is that stone which he gets is probably through food, like suppose in the rice something has gone in and that is has produced a stone, or they also feel that yesterday night he has taken a tomato, that seed has gone and produced a stone. These are all misnomers, they are not correct. A kidney stone is formed out of calcium most commonly, oxalate and phosphate and uric acid. They are the common components of the stone. Now all of them they are present in our body, in the blood, and they are required. All of them are important products. When they become excess in quantity, so what is known as a concentration or supersaturation, they get deposited down in the urine and form a small crystal. Crystal means, you can say how small. Just to give an idea, if you divide a 1 millimeter into 10,000 parts, that is one crystal. It is so tiny. So these crystals, once it forms, because of the concentration, excess concentration of either maybe say calcium and oxalate, they come together and form a stone, a crystal. And this crystal keeps on accumulating. Once it forms more and more and more, and that forms a stone. How small can stone be? I can show you. If you see here, I don't know whether you can see it or not. And as it grows, how big it can grow, you cannot imagine how big a stone can grow. It's difficult to believe. Both the stones are weighing more than 120 grams. So once a small stone is, just to show another thing, this is also a stone, like a cricket ball. This is a stone from the kidney. So stone can be of various sizes, as I mentioned, from few millimeters to say 10 centimeters. We have removed a stone measuring more than 13 centimeters recently. So all that sizes can be there. So once a stone is formed, it is difficult to dissolve. But in a very early stage, when the stone is say less than 5 or 6 millimeter in size, one can try the standard treatment of lot of fluids. Then there are herbal preparations in Ayurveda, they are also there in homeopathy or many others. But not all stones will fall out. One has to remember, because when the stone is very hard, it is impacted, it may not get dissolved. Suppose somebody has got a stone which has been seen and there are no complaints and small size. I had no objection in carrying out a herbal treatment. In fact, I had formed my own patented medicine for this. But I tell my patients, don't expect that 100% stone will fall out. And this is the problem with most of the people, that once they start taking some alternative treatment, pain is not there, so they feel now there is no pain, stone must have passed out. But the same stone can grow. There are two types of patients, we have seen this. One is known as symptomatic. Symptomatic means because of some complaint, and generally symptomatic means this stone has got moved from some in the collecting system of the kidney or drainage system of the kidney and blocked him, he got a pain. That is the sign in these patients, and obviously he'll go to a doctor and then he will take treatment. And if he doesn't follow it up, this same stone will grow. There are some patients where they may not have any of these signs, and stone keeps on increasing gradually in size over a period of time. Especially this particular stone, a stone which is completely occupied interior of the kidney, it is called as staghorn stone. Staghorn stone is a staghorn stone, which is like a horn of a stag. So these are the ones they gradually keep on growing within the kidney, and these are the unfortunate patients. They may not have any way to find out. Maybe some because of incidental reason. Because of some incidental reason, they have gone to a doctor, or maybe some blood in the urine or some infection, and they find out staghorn stone. This is a common story of staghorn stones. So maybe 5 to 10% of the stones, really speaking, may not get detected unless you do investigations for some other reason, or some vague pain you are feeling here and there, some vague low backache. That time these are get diagnosed. But I have seen patients growing stones in both the kidneys. Recently I removed a stone almost 8 centimeters. The gentleman was 72-year-old, and he went to a doctor for hypertension. So doctor said, let's do kidney checkup, and they found some proteins in the urine, and then they did the sonography. They had a large stone. So this stone is 13.5 centimeters, weighing 196 grams. So this patient, he was alive still. We operated in a endoscopic technique, a new technique what we have done it. But the point here is, once the stone is formed, whatever treatment you take, as I said, maybe in earlier stage you can try with alternative means, but always do a follow-up study. And if you find even in spite of couple of months the stone is not getting passed out, one can think of taking some intervention like removal of that stone. Another thing I wanted to mention here, that most of the time we feel the stone will cause pain. But as the stone becomes bigger and bigger, older and older, the pain becomes less. Here, because of that large size of the stone, the kidney shuts is functioning and become working less. The other kidney does the compensatory work. And lesser the pain, patient feels now there is no pain, so my stone must have gone. But these are the stones which will gradually completely damage the kidney, and what we call it as a non-functioning kidney. So not necessarily, in fact these stones which I am showing you, these are the patients, they never came to me for the pain. They came to me some urinary infection, some burning in the urine and hypertension. These are the totally unrelated complaints to these stones. So the point here, a stone which is a completely treatable condition requires, you can say, a herbal treatment, it is observation and follow. If it is causing obstruction, one should not wait, because again I talked about Ayurveda. But what has happened in many times when you take Ayurvedic treatment, a stone is big, the pain goes and patients remains completely silent on this, and then we are seeing that can completely kidney get damaged. Ayurveda has never said this. It is a patient's own understanding, or somebody tells him since there is no pain, don't do anything. But that is not correct. It might produce a serious disorder of removal of the kidney. And sometimes we have seen kidneys in the both kidneys having the stone, the patient has landed into kidney failure and requiring dialysis. Patient asked me, what should I eat, what should not I eat? Again the same principle, flushing. How you keep your toilet clean? By putting repeated water. So flushing is most important. Enough, adequate, regularly, timely fluid intake. Generally, fluid intake can vary from 2.5 to 3 liters, depending upon season to season, depending upon your profession. You are working in a hot profession, probably you are getting still more. Don't hold the urine, pass it regularly. Take the food which is good for digestion. The acidic food components, especially it has been found out, soft drinks, which are available. Then junk food, bakery products, they are injurious to the health, and also they make a great role in formation of stones. So I tell my patients, you avoid bakery products, avoid soft drinks, have a natural fruit juices, take a lot of fruits and adequate amount of water.